Hello, everyone. Another week. Pleased to say that the number of individuals in isolation has not gone up dramatically. There are 5. The really good news is that they are not overly sick. So, that's just fantastic. And that has been the case all along. We always get very worried when someone does catch COVID because you immediately think, or Omicron. Colleagues, from the 38, we went right down to nearly 10, and then it spiked at 26, and we're now at 24 colleagues off at this moment in time in isolation. And I think, as we said before, a lot of this is going to be down to their children at school and catching it, bringing it home, and so on. But it's looking as expected. It's a very tight in one of our homes at the moment, which is now into a second lockdown, and a lot of those 24 colleagues are actually from that single home. So it does put pressure on, but we're handling it. And looking back over the last 7 days, we have done 1,970 tests, which does show that the numbers are coming down from a peak of over 2,000, which does reflect the number of colleagues and individuals, or the lower number of colleagues and individuals who have tested positive for COVID. And it's actually now the results of those tests are coming back much, much faster. So delighted to be able to say that now where we are on the end of the week, 3 weeks into the new year, that actually the testing results are back under control, because it was really quite depressing what was happening before. Just trying to think what else that there is. There is the change of regulations that have been announced, which come into effect on Monday. Please don't get too excited about this. We haven't seen the detail yet, but it's very much seems that it's all about elder care. It doesn't take into account that our sons and daughters are not in an elder care service, that they should have the same rights as everybody else, but they are being shut down, and they actually should be able to go out into the community with all of those things. So it's quite depressing, but it's what we've come to expect, which is a complete lack of understanding or an inability to act in the best interest, to be honest, of people with learning disabilities who have been triple vaxxed, and who, obviously are less vulnerable than elderly people. So it's disappointing, but we're making the most of all of that. It was actually raised with me by the other day by someone who said, well, if we're now coming out of all of this, and we are, it's taking the time to come out of it. If we're coming out of all of this, then everything's going to go back to normal. Nothing's going back to normal after COVID, mainly because the whole staffing scenario, not just for in social care, but in all areas of the sectors, and not just in this country, but in all countries, it seems, is being completely upended. There is a massive shortage of staffing everywhere. We are investing massively. We've increased what we're paying staff and our cost of staff by 19% in this financial year, which is just massive. And yet all it's really allowing us to do is to stand still, but at least we're not going backwards. Although hopefully we will start to go forwards. We are having to be everly more inventive and creative about who we target and so on, because actually there are not staff around. So it's going to take a long time for the sector generally to recover and for the economy generally to adjust. I'm not sure what the ultimate answer is to all of this, but we are busy thinking about it and busy acting on it. We're pushing out our sort of PR, we're pushing out everything to attract colleagues and so on. And actually, it's a fantastic opportunity to work for us, because you come in at just over £10 an hour, and we've got people who are earning way above that. There's a lovely recruitment film that's just gone out with someone who came in on a fast track scheme, which now would be, I think, about £10.80 with no previous experience. This under our new rates. And within 6 months, they have been promoted to assistant manager level, and they've got continuous training, support, and everything all the way through this. So we're really excited about the model, and it's fantastic that we can bring people from outside of care who have fantastic attributes and qualities and freshness and so on, and that we're able to mold them within our systems. And this is obviously because we're doing a sort of data informed new model of care, which is what we've been developing over the last 11 years now. But anyway, it's all going to get better. And it is getting better, and we will be out of this horrible situation, but it will be into a different situation. And I cannot thank our amazing staff teams, our colleagues are just putting together everywhere, whether that's in the homes or our intersourcers who do housekeeping shifts and management who are positioning themselves out of the different homes and delivering care and support as necessary just to get over this hump. So I would like to thank everybody for tuning in, and have a great weekend and a great week, and catch up with you next week.